Welcome, everybody, to another episode of Compliance Reality, where we discuss the reality of enforcement and compliance programs today. Our topic today is HIPAA Security Risk Assessment. Just do it. We're going to talk about the importance of doing a HIPAA Security Risk Assessment, why people continue to fail to do an enterprise-wide comprehensive risk assessment is beyond me. And we're going to discuss some cases of enforcement and some tools available to you so that you can just do it. My name is Dr. CJ Wolf. I'm a compliance professional with over 22 years of full-time compliance experience. I left medical practice, the clinical world. I'm an MD by schooling, but I left that many, many years ago and have been working full-time as a compliance executive. I've worked for institutions such as Intermountain Healthcare, University of Texas System, MD Anderson Cancer Center, and an international medical device manufacturer. I also hold faculty appointments at universities where I teach, and I am doing a lot of private compliance and coding consulting and training. So if you're in need of any of those services, please keep me in mind. You can reach me at the email at the bottom of the slide here, info@compliancereality.com. I also have multiple certifications in medical coding, professional coder, outpatient coder, as well as healthcare compliance certifications, some basic certifications in healthcare compliance, compliance and ethics professional, as well as a little bit more specialized certifications in healthcare privacy and healthcare research. Let's jump in to our topic today. I want to share with you some examples of healthcare providers and entities that have gotten into trouble because they failed to conduct a risk assessment. And we're talking HIPAA security rule here. So this first press release that I'm sharing here is for a clinical laboratory that agreed to pay $25,000 to settle potential HIPAA security rule violations. They also agreed to enter a 3-year corrective action plan. And one of the major findings that the OCR found was failure to conduct appropriate risk assessment. That was one of the major potential violations. And we're going to see this pattern repeat itself. Now, if you're listening to the podcast, I'm going to include all the links in the show notes. I'll do the same here for the YouTube channel. So the links that you see on the screen will also be in the show notes. So, failure to conduct an appropriate risk assessment. This was an issue for this particular clinical laboratory, Peach State Health Management is what they're called, doing business as AEON Clinical Laboratories. And it's just so important that on the HIPAA security side of things, you do a complete, comprehensive, appropriate risk assessment. What does that mean? Well, we're going to talk about what that means. Let's first talk a little bit more about what happened with some of these cases. So what did the OCR comment on in regard to this clinical laboratory? The former acting OCR director said, the failure to implement basic security rule requirements makes HIPAA-regulated entities attractive targets for malicious activity and needlessly risks patients' electronic health information. This settlement reiterates OCR's commitment to ensuring compliance with rules that protect the privacy and security of protected health information. Now, this clinical lab entered into a corrective action plan, and I'm going to share some of the key aspects of that corrective action plan on the left of this slide. But first, is there a law? Is there a rule that says you have to do a risk analysis? The answer is yes. Here's the citation, 45 CFR 164.308. You can see the subsections here. But basically, the CFR says risk analysis, which is a required element, you must conduct an accurate and thorough assessment of the potential risks and vulnerabilities to the confidentiality, integrity, and availability of electronic protected health information held by the covered entity or business associate. Now, in the corrective action plan, it was spelled out what this entity had to do. And one of the items that it had to do was perform a security risk assessment or risk analysis. A lot of people use these terms interchangeably. On the left side of the slide, you can see some of the things that are required in the corrective action plan. First, the entity had to conduct a comprehensive enterprise-wide risk analysis. What are they looking at? They're looking at threats and vulnerabilities of all ePHI or electronic protected health information that's created, received, maintained, or transmitted. This is a broad universe here of ePHI. It's kind of, I've always used the analogy of it's like water. If you've ever had a leak in a home, water finds the cracks, it finds the ways into places that make a mess. ePHI is like water. If it finds a way out of the organization, it can and it will. And you need to make sure that any ePHI that's created, received, maintained, or transmitted is done so in compliance with these security rules for PHI, which is the HIPAA security rule. They also go on to say that all this ePHI, wherever it may be, including all electronic media, workstations, and information systems owned, controlled, or leased. Are you using your cell phone to look at PHI? Well, there you go. So again, my analogy of water, if there's a way for ePHI to get out, it'll find its way, and you need to seal all the cracks, so to speak, so that the water doesn't leak out or the ePHI doesn't get out. So in regard to all these devices which store or can access ePHI, again, my example of a cell phone, if you're accessing ePHI, that cell phone now is a device that needs to be included in your risk assessment. You need to develop a complete inventory of all devices and access points for ePHI. Also, they stated to review the risk analysis annually. So once you do a risk analysis, it's important that you're reviewing it on a regular basis, maybe even repeating it on a regular basis. And on this last bullet point, they said that the entity had to promptly update the risk analysis in response to environmental or operational changes affecting the security of electronic PHI. So if something's happened in the organization, maybe there's a merger, or an acquisition, that is an environmental or operational change, in my opinion, that would require an update to looking at your risk analysis. What if you obtain a new electronic health record, or there are major changes in, who's hosting cloud information, these sorts of things. Those are, in my opinion, environmental or operational changes that are significant enough that you need to review your security risk assessment. Let's go on to another announcement. This one was a health insurer who agreed to pay $5.1 million to settle a data breach affecting over 9.3 million people. Now, these are the big ones that you often hear about. There are small ones too, and we're going to share another one of those in a moment. But this entity, again, agreed to pay $5.1 million. They agreed to enter into a 2-year corrective action plan. And again, one of the major findings or potential violations based off of the OCR comments and press release and a corrective action plan agreement was that there was a failure to conduct an enterprise-wide risk analysis. What is that? Hang on, we're going to get to it. We're going to tell you what an enterprise-wide risk analysis is and some tools. We're going to share some tools with you. But in regards to this health insurer, the then director of OCR said, in this case, a health plan did not stop hackers from roaming inside its health record system undetected for over a year, which endangered the privacy of millions of its beneficiaries. Healthcare entities need to step up their game to protect the privacy of people's health information from this growing threat. And one way that you step up your game is you do the mandatory security risk assessment or comprehensive enterprise-wide risk analysis. The next one that I'm sharing here is a healthcare provider, a solo GI doc, so a gastroenterologist. So it's not just big insurance companies and hospitals, even the small guys, the single doc practices are finding enforcement here. This particular solo doc agreed to pay $100,000 to settle with OCR for failing to implement some basic HIPAA security rule requirements, agreed to a 2-year corrective action plan, and again, one of the major potential findings listed by OCR was, quote, failure to conduct an enterprise-wide risk analysis. And in this particular corrective action plan, the medical practice was required to do a security risk assessment, or this enterprise-wide risk analysis. And here are some key phrases and words used in that corrective action plan. Quote, the practice shall conduct an accurate and thorough assessment, risk analysis, of the potential security risks and vulnerabilities to the confidentiality, integrity, and availability of the electronic protected health information, EPHI, created, received, maintained, or transmitted by the practice or on its behalf. Next, the risk analysis shall incorporate the practice's facilities, whether owned or rented, and evaluate the risk to the EPHI on its electronic equipment, data systems, and applications controlled, administered, or owned by the practice that contain, store, transmit, or receive EPHI. Again, this is a big universe. EPHI, again, my analogy, acting like water. If it leaks, it'll get out. And you need to solidify all of the containers that hold that EPHI, so to speak. Prior to conducting the risk analysis, the practice shall develop a complete inventory of all its categories of electronic equipment, data systems, and applications that contain or store EPHI, which will then be incorporated into its risk analysis. So a major part of doing a risk analysis is doing this inventory of all these categories. Now, what's interesting in this physician scenario, it was brought about because the physician complained that his business associate who was involved in the medical record that he was using was not allowing him access until he finished paying a certain amount of the contract. So there was kind of this financial dispute. And so the physician complained to OCR. OCR came in and found that the practice itself was having issues. And so something kind of peripheral brings OCR in. They do an investigation and they determined that the practice had not done a comprehensive risk analysis. So let's move on to some of the tools that are out there for performing a security risk analysis. These are things that are available to you that should help you perform a risk analysis. First, HealthIT.gov. So as you can see on this slide, I've just taken a screenshot of the page that discusses a security risk assessment tool. So you will probably need, and you don't have to use this tool, but this is something that HealthIT.gov has created that you can download, and it's a program that once you've downloaded it, it can walk you through some of the questions, some of the processes that you should be reviewing when you do when you should do a security risk assessment. So this is a useful tool that a lot of people use. On this next slide is just a screenshot. I downloaded the tool. It is free, and it shows you can enter practice information, the assessment summary. You can save, and you can do these steps, and it walks you through some of these steps. The SRA tool has 3 core steps. You can see. Number 1, enter your practice information. Number 2, answer the assessment questions. Number 3, review your final risk report. So, without going into all the details of what this tool contains, I just wanted to introduce you to one of these tools that is out there. Again, it's not the only thing you can use, and you probably want to make sure that you have qualified people doing this sort of work, but it is something that is available to you if you don't have something. There's also many commercial tools and products out there that can also guide you through a security risk assessment. The CMS Medicare Learning Network also has some information on the HIPAA security rule, so you might want to use this link to see what the CMS MLN has as far as training. OCR, Office for Civil Rights, has a guidance document. This is a 9-page guidance document that walks through a lot of great aspects of performing a risk analysis. And these are some of the things mentioned in this document. First, just the basic requirement that a risk analysis is required under the security rule. Then it goes into some of the definitions that we often hear, but what do they really mean in regards to the HIPAA security rule, such as vulnerability, threat, and risk. What do those words mean? The document continues by talking about a scope of the analysis that you're going to perform. We hear this phrase enterprise-wide, comprehensive enterprise-wide. So what is the scope of the analysis you're performing? What kind of data are you needing to collect to do this analysis? It continues by discussing to identify and document these potential threats and vulnerabilities. Then there's a section on assessing your current security measures. What do you currently have in place? Then determine the likelihood of threat occurrence. Next, determine the potential impact of threat occurrence. Next, determine the level of risk. And then it ends by discussing a periodic review and updates to the risk assessment. Once you're done, it's not done. I mean, you may be done for the day, but this is an ongoing type of activity where you're constantly reviewing and assessing, what's changed in the organization that is significant enough that we need to perform this review again. And so most organizations will perform a HIPAA security risk analysis on a regular basis. Some are doing it annually. There are some, if you're a physician practice, for example, and you are participating in MACRA and these incentive programs, there are some requirements for you to perform a risk analysis every year in certain scenarios. So a lot of organizations, especially physician practices, are doing this on an annual basis. And other than that, is there a law that says you have to do it more frequently? Not one that I can find, but there's best practice, and most organizations are doing a security risk analysis on an annual basis. Once you've done the first one, if there aren't significant changes in the organization from year to year, then you're basically reviewing what's been updated, what's been changed. But you'll be surprised that certain things change and get updated, and you might not know about them until you do a dedicated risk analysis. The next set of tools that I wanted to discuss is also published by OCR, and it's called the HIPAA Security Series. This is a series of 7 documents, multi-page documents. You can see here the 7 different categories, and these documents range from 11 pages up to 29 pages. And so there are 7. The 7 topics are: number 1, Security 101 for covered entities. That's an 11-page document. Number 2, security standards, so administrative safeguards. That's a 29-page document. Third is security standards, physical safeguards, 17 pages worth. Fourth is security standards, technical safeguards, another 17 pages. Fifth are security standards, which jumps into organizational policies and procedures and documentation requirements. That's 12 pages. And number 6 is the one I've kind of bolded and underlined because we're talking about risk analysis. And so number 6 is really where you get into the basics of performing a risk analysis and risk management. And that's a 20-page document. So number 6, series number 6 might be a very helpful document as you're looking for tools to perform a HIPAA security risk analysis. And the last one, number 7, is security standards implementation for the small provider. So if you're a small physician practice, you don't have extensive resources, number 7 might be a very helpful guidance document to consider when you're looking at security standards. So these are all tools that may be helpful to you. You may also want to engage somebody, external, a consultant. I do this kind of work as well. There are many out there, though, if you need additional guidance and help walking through an actual security risk assessment. If you have questions about this presentation, or if you have ideas for other topics for future presentations, please reach out to us at info@compliancereality.com. And as I mentioned, if you're in need of help with your compliance program, or you're considering consulting and training services, please keep us in mind. You can reach us again at info@compliancereality.com. So thank you for listening to this episode. The major message is just do it. Got to do that HIPAA Security Risk Assessment. Just do it. Thanks for listening. Have a great day.